Okay, everybody, this is the continuation of our lecture for today, continuing the anxiety disorder lecture, and we will be basically following the outline. My slides here are exactly what your outline has continued. So let's start with looking at treatment modalities. That's page 580 in your book, and these are treatment modalities for anxiety disorders. Like I said, it starts on page 580 in your book, and I'm just going to briefly cover these, and I would like you to read more and take more notes on that in your book. So to begin with, let's look at individual psychotherapy. This would be one-on-one counseling, one-on-one, therapy with a, licensed therapist, counselor to work on anxiety. They're going to be spending a lot of time listening to the individual, looking at what their strengths are, exploring their different types of coping mechanisms that the patient has or the client has, and to build on those coping mechanisms, teaching new coping mechanisms. So it's really just very individual to that person, helping the client understand the all the different types of situations that might elicit or bring up anxiety, and then to further explore those and try to understand what's going on with that anxiety. The next modality is cognitive therapy. And cognitive therapy we've talked at length about before. People with anxiety, cognitive theorists would say that they look at situations in a dysfunctional way, that they are appraising the situation, if you will, in a dysfunctional way. They think they are in danger, or they think they can't cope based on how they look at the situation. Okay, and therefore, because they're looking at it dysfunctionally, that causes excessive anxiety. Therefore, to decrease a person's anxiety, cognitive therapy would say we need to change the way that they look at this situation. We need to change their thinking patterns, change their coping or their cognitive distortions, and give them rational ways of looking at the situation instead of irrational ways that cause anxiety. So they encourage the person to become aware of their thoughts prior to the feeling of anxiety, and to look for faulty thinking or cognitive distortions that are causing the anxiety, and then obviously replace those cognitive distortions with logical thoughts, logical and rational thoughts. They would want to make sure that they have structured, orderly, and identify and correct any type of illogical thoughts. And again, replace the illogical thoughts with logical thoughts. This is can be very helpful with phobias, but also with obsessive compulsive disorder. And then the last one, at least on this slide, is behavioral therapy. And two areas of behavioral therapy that we're going to look at is systematic desensitization and implosion therapy, or flooding. Systematic desensitization, I kind of mentioned that before, talked a little bit about that before, but this is where you gradually, or this is very helpful for people with OCD and with phobias, but that you gradually expose the person to a phobic stimulus or whatever their phobia is. And it can be either, doing it in a real situation or just having them imagine it. Okay. So, and that gradual exposure to that phobia or to that stimulus is going to build up tolerance so that they can handle that. But prior to exposing them to the systematic or to the phobia, we want to teach them to be relaxed. So there's a lot of training in relaxation techniques. It might be progressive muscle relaxation, imagery, meditation, but to really train them on how to relax your body, how to calm your heart rate down, how to calm your blood pressure down, your respirations, and to be very calm and relaxed. And then after a person can get their body into a very relaxed state, then there's this gradual or progressive exposure to the object of fear while they are in that relaxed state. And once they are able to handle a very small amount of exposure to that phobia or that stimulus, and stay in a relaxed state, then they will gradually increase that exposure. So I gave the example of a person who might have a phobia about dogs. So first of all, that person would be trained in a very how to get their body in a relaxed state, and then gradually maybe talk about dogs, look at pictures of dogs, and once they can handle that and stay in a relaxed state, then they will maybe bring a dog into the room, all right, and then again work with keeping them in a relaxed state, and then getting closer and closer to the dog, and then maybe petting the dog, etc. So it's gradual, that progressive exposure to the fear. The belief here is that you cannot be relaxed and anxious at the same time. Okay, the next one is implosion therapy or flooding. And this is similar, but this is where you have the person imagine for a prolonged period of time, or you actually have them participate or be in the situation of being extremely frightened. So what am I saying here? So what we are doing, we're not necessarily having them practice relaxation or be in a relaxed state, but it's just flooding them with this phobia or this extremely frightening situation, and you keep them there for a very long time until they have almost kind of burned themselves out of the anxiety and are in a relaxed state. So in one way, that almost seems, kind of like, kind of torturous in a way, but of course the client or the patient would agree to this, and this may not be a therapy for everybody, and many times clients do not want to engage in this type of therapy, but it still is a type of therapy where you just expose them either in imagined situations where the therapist talks them through a very, a frightening situation or a phobic situation, or they are actually in that situation and remain in that situation until the anxiety has decreased. So read a little bit more about that in your book. Okay, and that's the next slide. And then we go on to just talking about general interventions or general interventions for anxiety and anxiety disorders. The first one that I have down there is applied relaxation. And this is where you work on applying relaxation techniques when you are having anxiety. Okay, so you might be taught progressive muscle relaxation, deep breathing, diaphragm breathing, that sort of thing, and then you actually apply that relaxation when you get into an anxiety situation. So it's not necessarily the desensitization, but maybe every time I'm going to be having a test and I have test anxiety, then even if it's during the test and I feel myself becoming very anxious, I'm going to do this applied relaxation. So I might take 30 seconds or 1 minute during the test and just make sure that I'm deep breathing, thinking through all my muscles and relaxing them. Okay, so that would just be one example. Respiratory training is kind of what we just talked about, but where you're actually teaching the client deep breathing techniques, and there is a variety of deep breathing techniques, but teaching that and then having them practice that. But a very deep breath where you expand your lungs, but also expand your diaphragm, and you may hold your breath for first of all 5 seconds, but then expand that where you hold your breath to maybe 10 seconds, 15 seconds, 20 seconds, and then let it all out through pursed lips, and you take all the air out of your lungs. Okay, and then just continue to do that for a long many minutes until you're very relaxed. Coping skills training, that is where a person is learning how to apply all of the things that we just talked about. When and where do they use the applied relaxation? When and where should they be doing respiratory training and applying that? And then actually putting that into practice. Also, coping skills training may be learning self-control in situations, how to manage anxiety, using, other types of resources. Coping skills training might involve, also journaling, talk therapy. It might be, knowing that I need to get a good night's sleep, I need to exercise every day. So those are some examples. Another general intervention is to promote communication with these individuals, encourage them to express appropriate communication about anxiety. Some people will feel anxious but will not admit it to themselves, or they will not talk about it. And that can just, that is unhealthy. Those are defense mechanisms that don't allow the person to cope effectively with that anxiety. So encouraging them to express their anxiety appropriately. Being in touch with their feelings, listening to their body, but also listening to their feelings and doing self-reflection and being aware of that, and then expressing that appropriately. Other just basic things with people who have anxiety disorders: stop drinking coffee and stop using caffeine. Those can greatly contribute to anxiety, and also coffee and caffeine can actually decrease the effectiveness of benzodiazepines and some of the other anti-anxiety medications. So it will not allow your medications to work most efficiently. Avoiding excess alcohol, making sure that the individual is getting adequate sleep, 7 to 8 hours. Sometimes that's difficult for some individuals, but to as much as possible, to get adequate sleep. And then moderate exercise. Sometimes we get so busy we forget about that moderate exercise, but even 30 minutes a day or 30 minutes 5 times a week is going to help with that, with our anxiety and with our ability to relax and our ability to cope. Okay, the next slide here I have is the nursing process with post-traumatic stress disorder. And we have different diagnoses down here. The first nursing diagnosis is post-trauma syndrome, and there is a very good care plan on page 597 in your book that I want you to read through, and I want you to know that. I'm just going to briefly cover that, but that'll be your responsibility to look at that. But post-trauma syndrome is a persistent maladaptive response to traumatic and overwhelming events. Okay, so persistent maladaptive response to a traumatic or overwhelming event. So that's what post-trauma syndrome is. And so PTS individuals normally or obviously would fit in with this nursing diagnosis. Goals here is to help the client begin a healthy grief process. Many people, when they are in a traumatic situation, part of that trauma is grief. It might be grief about losing a loved one. It might be grief about losing a portion of themselves, say as a rape victim. It might be if a trauma is losing your house in a tornado or something like that. But many times there's grief aspects that go along with post-trauma syndrome. Another goal is that the person would demonstrate ability to deal with their emotional reactions. Okay. And that might be demonstrate ability to deal with their emotional reactions by using applied relaxation or using respiratory breathing. So there would be, ways that you could measure that. Interventions are on the care plan, and as I said, that was page 597. Let me look at that real quick. Or I'm sorry, 594. Let's see here. Sorry, I'm just looking at the correct page number. Yeah, I'm sorry, it is page 597 to look at that care plan. But you can see that the nursing interventions on there, trying to have the same staff as much as possible so a therapeutic relationship could be established. Staying with the client during periods of flashbacks and nightmares. And that's kind of when they're in that kind of a panic type of situation. All those interventions we already talked about to use when a person is in panic anxiety. Encouraging the client to talk about their trauma. Again, discuss coping strategies used in response to the trauma. Assist the client to comprehend the trauma if possible. So I want you to look at those rationales as well. The next nursing diagnosis down there is complicated grieving. And this usually is referring to after the death of a significant other or another loss. Again, as I mentioned before, many times people who have gone through traumatic experiences, there is a death of a significant other or another significant loss. We want them to be able to go through a normal type of grieving or a normal bereavement, or have a normal response to the loss of a significant other or another type of loss. We don't want it to become complicated. So outcomes, we want them to verbalize feelings associated with the trauma. And that might be, verbalizing feelings of guilt or anger or self-blame, but helping them to verbalize that and to know, that those are feelings that everybody has that goes along many times with grief. Another outcome is we want that person to be able to progress in dealing with stages of grief. And we want them to verbalize optimism, or we want them to verbalize a hope for the future. Interventions are similar to the post-trauma, but we want them to acknowledge their feelings, talk about their feelings, try to assess what stage of grief they're in, teach them about normal stages of grief. There's a lot of education that goes along with this. Assess how the trauma might be affecting their daily activities, their daily life. Assess if they have any type of self-destructive ideas such as suicide or any other type of self-destructive thoughts. Assess the person's coping mechanisms, and then obviously to teach new coping mechanisms, help them to build on their strengths and use their resources. Help them identify community resources as well, support groups, support systems that are going to be beneficial to them. Okay, and the last slide we have here is treatment modalities for post-traumatic stress disorder. Again, we have cognitive therapy, very similar to what we were talking about before, but modify the way that they look at the trauma through their thoughts. Okay, and assessing what their thoughts are, how they what irrational types of thoughts they might have that are surrounding the trauma, and then to try to replace those negative thoughts, those dysfunctional appraisals of the trauma, into a more logical and rational viewpoint of the trauma, and then to move on from there. Prolonged exposure therapy is very similar to flooding that we just talked about. This is where the therapist will take the person through either they imagine it and talk a lot about the, kind of walking them through imaginary situation where they're exposed to that trauma again, or they take them through as much as possible kind of a real life situation. They're exposed to repeated and a prolonged experience of the trauma. And what this hopefully then is doing is that they, because they have this prolonged exposure to it, their memories start to become neutralized, or their memories start to not produce the anxiety or the trauma experience that they had before. So some of the prolonged exposure therapy that they're experimenting with is having maybe combat soldiers who have PTSD is video games that take them through some of the same situations that they've been in. Granted, it's not 100% real life, but it's more than just imagined, but a real like 3D video game where you're actually living through all of that. And you're with a therapist as you're walking through that situation and you're talking about it, but you're being exposed to that and talking through it as you're being exposed to it. And hopefully that prolonged exposure is going to decrease that anxiety. The last one we have here is eye movement desensitization reprocessing, which is EMDR. And this is relatively new. They're using it more and more with PTSD, and actually it's very interesting. It's actually pretty complicated, and in a way a little bit hard to understand what exactly is going on. But the belief is that and it's interesting to look at YouTube, but the therapist has to be trained especially for EMDR, but that they will put a finger in front of the person's eyes and ask them questions about their about the traumatic event, but also ask them to follow quickly their finger so that they're having, you know, this extreme rapid eye movement as they are talking about their the trauma and being asked to recall memories with the trauma. And really, the basic belief is that when a person went through the trauma, they did not store their memories correctly, and the memories have been stored in the wrong, if you will, the wrong part of the brain. But this EMDR helps those memories to be reprocessed in the appropriate way and stored in a more appropriate way where it will not cause as much post-traumatic stress. So you can go ahead and read about that. I'm not going to ask you very many questions about that, about EMDR, but just know that it is a newer treatment with rapid eye movement that helps with helping the person to reprocess their memories and store their memories in a way that results in a decreased anxiety for the individual. And that's all that I have for this voiceover. Thank you.